morning, dear students. This is Dr. Sunil, and today we are going to discuss unit number 3, topic cardiac glycosides or drugs acting on congestive cardiac failure. Congestive cardiac failure is a condition which is characterized by inefficiency of the heart to pump proper oxygenated or sufficient oxygenated blood to various organs of the body, and this is due to decreased rate of contraction or decreased force of contraction. And the drugs which are used in this situation, which are used to treat congestive cardiac failure, are called positive inotropic drugs. Positive inotropic drugs, they increase the rate and force of contraction of the heart so that the blood flow, oxygenated blood flow to the organs will be restored. And very popular agents of this class are cardiac glycosides. These are also called steroidal glycosides, which are of plant or animal origin, and they are very well known from so many years. And some of the agents you might have already discussed in pharmacology, the drugs like digitoxygenin, digoxin, etc. are available from the plants like Digitalis purpura, Strophanthus combe. Okay, so when I say these are glycosides, structurally they are made up of two units, aglycone and glycone. You can see it on my screen. Okay, so when I say these are glycosides, structurally they are made up of two units, aglycone, which is responsible for the therapeutic activity, and glycone, which is responsible for the solubility and distribution of the drug in the body. In case of cardiac glycosides, the aglycone is a large lipophilic structure. In fact, it's a steroidal structure which is responsible for the activity, and it is connected to sugar by a glycosidic linkage, and these sugars are responsible for the solubility and distribution throughout the body. Okay, so let us advance in our topic with the structure of aglycone as well as glycones. Yeah, you can see the general structure of cardiac glycosides on my screen. Okay, so as I said, this is a steroidal glycoside which is derived from cyclopentanoperhydrophenanthrin ring structure, and you can see 4 rings are fused in the structure of cardiac glycosides: ring A, ring B, ring C, and ring D. Okay, and these aglycones are classified based on the lactone which are attached at 17th position. If the lactone is a 5-membered alpha beta unsaturated lactone, they are called cardinolides, and cardinolides are mostly seen in the families like Strophylaceae and Sterculiaceae. And if the lactone is a 6-membered lactone, the compounds are called bufadienolides. They are mostly seen in the families like Ranunculaceae and Liliaceae. Okay, and coming to the numbering of cardiac glycosides, the numbering starts from ring A and it travels around ring B. See, you can see position 5 here. Normally, in case of fused ring structures, the carbon which is fused, the bridgehead carbons are not numbered. But there is an exception in case of steroid chemistry. Even the bridgehead carbons are numbered. The bridgehead carbons are numbered. You can see at number 5. Okay, so then 6, 7, 8, 9, and 10. Again, one more bridgehead carbon. It is also numbered. Then 11, 12, 13. One more bridgehead carbon, and 14, 15, 16, 17. And there are 2 angular methyl groups which are attached at C13 and C19. They are designated as C18 and C19. Okay. Apart from that, there are 2 hydroxy group in each of the cardiac glycosides, one at C3 and another one at C4. And these two are in beta orientation. C3 hydroxy group as well as C4 hydroxy group are in beta orientation. And coming to the stereochemistry, there are 4 rings which are fused in cardiac glycosides. Ring AB are cis fused, ring CD are also cis fused, whereas ring BC is transfused. Okay, so this is the stereochemistry of aglycones. Okay, right. I repeat, aglycone is a steroidal structure. When I say it's a steroidal structure, it is a derivative of cyclopentanoperhydrophenanthrin ring structure. Okay, and the numbering starts from ring A, and we can assign the numbers to bridgehead carbons also in steroid chemistry. Okay, and at C17, each aglycone is attached with a lactone, and that lactone can be a 5-membered or a 6-membered alpha beta unsaturated 5-membered lactone or alpha beta unsaturated 6-membered lactone. If it is a 5-membered lactone, those compounds are called cardinolides. If it is a 6-membered lactone, those compounds are called bufadienolides. Apart from that, each cardiac glycoside, they are having 2 methyl groups at C13 and C19, and they are called angular methyl groups. Apart from angular methyl groups, there are 2 hydroxy group at C3 and C14. Particularly, C3 is very important because this is the hydroxy group which is involved in glycosidic linkage with glycones. Okay, so this is the chemistry of aglycone. Now let us see glycones. Okay, you can see the structures of the glycones on my screen. Okay, so Glycone is a sugar which is responsible for solubility and distribution of the drug inside the body. It does not have any therapeutic moiety. Usually 2 to 4 sugars are attached glycosidically at C3 hydroxy group, and the most commonly seen sugars are D-glucose, D-digitoxose, L-rhamnose and D-cymarose. Okay, so this is about the structure of glycoside, structure of cardiac glycoside on the whole. So we have just discussed the structure of a glycone as well as glycone. Okay.